Now, starting with the very first question, there where it was mentioned that a young male was found dead with a wound over neck. Now, edges of the wound were clean cut, and the vertebral bony portions were also disrupted. Okay, so when you have this kind of injury where the margins are sharp and the injury is extending deep till the bones and is damaging the bones as well, this is a classical description for chop wound, right? So this is a classical description for chop wound. Now, chop wound are the ones which are inflicted by some hard instruments like axe, meat cleavers, right? So the type of wound on the skin is actually an incised wound, which has, of course, clean and sharp margins, and the force of the injury is such that it can go and extend till the bone, where it can cause fractures of the bone as such. So this is chop wounds. Clear? Now, which feature differentiate artificial bruise from a true bruise? Now, bruise are actually also known as contusional injuries, and there is damage to the subcutaneous tissue without any damage to the superficial skin. So skin is intact, but the underlying subcutaneous tissue is injured. So that is a bruise or a contusion. Now, sometimes the bruise can be inflicted by certain irritant substances just for some motive, and such inflicted bruises are known as artificial bruise. So whenever artificial bruise is produced, there are certain features of irritation. So if we talk about false bruise, which are actually the artificial bruises, and here there will be features of irritation, namely there will be local reaction, right? So there is local irritative reaction, and because of irritation there will be itching. So itching is present here. Clear? And then there may be vesicles, okay, which contains serous fluid, right? And usually the areas are the one which are easily accessible for creating or inflicting those artificial bruises. But a true bruise, which is actually because of injury, it can occur anywhere, and here the margins are not well defined. But in a case of artificial bruises, the margins of the bruise are well defined, and a true bruise will show typical color changes with time, like it will be brown, it will be yellow, green, right? And after some time it will be normal skin color. So a classical or true bruise will show color changes with time. So these are few important differences between the true bruise, which is because of injury, okay, so a true bruise because of injury, and an artificial bruise is because of irritation. Clear? So if someone asks you which of the following feature of artificial bruise helps you in differentiating artificial from true bruise, the answer would be presence of vesicles. Clear? Because in artificial bruise, itching is present. In artificial bruise, there is no color change with time. This is a feature of true bruise, and an artificial bruise has well-defined margins, right? So the best answer here is presence of vesicles. Then moving forward to leading questions. Now, leading questions are the one in which the answer is either yes or no, right? So such questions are known as the leading questions, in which the answer is either yes or no, and this is allowed only during cross examination. It means party of one side and lawyer of other side, so that is cross examination. So the answer has to be either yes or no. There has to be no explanation or any other unnecessary discussion about the answer. Simply yes or no. Like whether you were there at the incident or not. So the answer has to be either yes or no. Then moving forward, a doctor referred a patient to a radiologist for X-ray, and then the doctor received a check from the radiologist for that referral. Now, what is this known as? This is medical dichotomy. Clear? So this is medical dichotomy, where an undue advantage or undue favor has been taken in lieu of some referrals, whether it may be some maybe for some investigations or treatment. So this is medical dichotomy. Now, a lady attended skin OPD with a photosensitive lesions on the area of the face. Now, which type of consent is this which gives the permission to the doctor to examine her face? So this type of consent, where a patient goes to a doctor, it is a sort of implied consent, where it is presumed that yes, the patient is ready for examination by the doctor. So this is an example of implied consent. Clear? So this is implied consent. A patient is going to a doctor, so it is presumed that he or she has already given consent for examination by the doctor. Of course, there are certain rules, like if a lady is there, it's better you always have a female nurse standing in the cabin before examining such a lady, right? So this is implied consent. Now, an unreasonable conduct or absence of ordinary care by the patient or his attendant, which is combined with the doctor's negligence, and then it contributed to the final injury. Now here, if you look proper, the doctor is negligent, number one, and there is some negligence from the patient or his relative, because there are two parties. One is the medical caregiver, and the other is the patient himself. So if both the parties are showing negligence to some extent, that is known as contributory negligence. It means whatever the final outcome is, whatever the final, thank you Ajay, thank you bhai, right? So not only the doctor is negligent, there is some degree of carelessness from the patient side also, which is finally resulting into the bad outcome. So here, doctor as well as patient, both the parties are negligent, and therefore this is known as contributory negligence. Now, this contributory negligence is good for doctors because they can use it as a defense. Clear? So the doctor can claim that I'm not the whole sole responsible person for this untowards, unwanted outcome. There is some lack from the patient side as well, and therefore this is the bad outcome of the patient. So this is contributory negligence. Both the parties, they have contributed for that unwanted outcome. Clear? So this is contributory negligence. Now moving forward to next question. Abdominal colic, obstinate constipation, loss of appetite, anemia, then stippling of RBCs, and the classical word blue line on gum. I think if you have all these words, there is no confusion whatsoever to mark it as a case of lead poisoning. So you can remember it like anemia, A for anemia, right? Then B for basophilic stippling of RBCs, clear? Then C is for, you can say, colic or constipation, clear? Then D for wrist drop, then E is for encephalopathy, F is for facial pallor. Clear? So these are all features of lead poisoning, and it's quite easy to answer a case of lead poisoning. Clear? So there is blue line over gums. This is also a classic, especially the tooth gum border. Fine. So classical case of lead poisoning. Then moving forward, a young male has taken unknown poison. He was attended and it was noticed that there is pinpoint pupils, there is sweating, there is increased saliva and tear secretion, and there is garlic-like smell coming from the body, which should be used to treat such a patient. Now, if you look properly here, see the effects. Pinpoint pupil. Now, what does this mean? Pinpoint pupil means the pupil is very small. So, it is, what do you say, meiosis or constricted. Then there is increased secretions. Increased secretions in the form of sweat, saliva, tears. So everything is increased. So this is suggestive of cholinergic effects. So these are all cholinergic effects. Clear? Because this is all parasympathetic overactivity. Now this is a classical case of organophosphorus poisoning, and the examples includes glyphosate, malathion, phantheon, formuthion, right? So all these, they act by promoting cholinergic activity, and therefore we will see salivation, lacrimation, urination, diarrhea, vomiting. Then there is, tachycardia, hypertension. So classical cases of the cholinergic activity. Yes, the answer is atropine, because this is cholinergic, so we need to give anticholinergic. Clear? So this is atropine, anticholinergic. Clear? So this is a classical presentation of organophosphate poisoning. Please read it properly. This is one of the favorite topics, right? So organophosphate poisoning, and the manifestations are cholinergic over effects. Clear? So organophosphate. Now, in case of grievous hurt, what is that time duration which is taken to label it as a grievous hurt? That time period is 20 days, right? So if a patient who has sustained injury, if he is not able to carry out activities for at least 20 days, the nature of the injury will be called as grievous hurt. So this is just one of the parameters under grievous hurt. Bed rest lasting for at least 20 days. Apart from that, there are many other conditions which will be counted under grievous hurt. One is, of course, emasculation. Then there may be injury to eye, ear, or any joint. There is disfiguration of face, that will also be counted in grievous hurt. And then any fracture, and most importantly, if a person is bedridden for a period of 20 days, that all will be counted under grievous hurt, right? So these are different parameters under grievous hurt. Now moving forward to another question, nothing is an offense which is done by a person who at the time of doing, by unsoundedness of mind, is unable or incapable of knowing the nature of the act, whether whatever he is doing is wrong or right. Now this is actually related to the criminal responsibility of the insane. Clear? So a person who is not of sound mind, very good Muhammad Anas. So if a person who is not of sound mind, he cannot be held liable for an act, because at the time of doing that act, he was not in a state to understand that whatever he is doing, whether that act is right or wrong. So this is defined under McNaughton's rule, that is the criminal responsibility of the insane. So if a person at the time of committing an act is of unsound mind, now unsound means he is not having normal senses, so he cannot be held guilty of the crime, whatever he has done in that state of mind, right? So this is the McNaughton's rule, which relates to the criminal responsibility of the insane. Now moving forward, a young male was arrested on charge of kidnapping a young girl, but he died in police custody. Now very good. If there is a death in police custody, the inquest will be carried out by judicial magistrate. And what is inquest? Inquest means inquiry into a case of death, right? So inquiry into a case of death. So if there is death under usual circumstances, it is always a police which comes, right? So police in usual circumstances. But if there is death under police custody, then it has to be magistrate. So magistrate in cases of police custody, right? So here the answer is judicial magistrate. Now next question. A young lady committed suicide after 4 years of her marriage, and there was a suicide note which mentioned that she was tortured for dowry. Now in such a case, who should conduct the inquest? Again, very good. So this is a case of dowry death. Clear? So this is a case of dowry death. And here it is said that if a married lady dies within 7 years of marriage, clear? That will be presumed as a case of dowry death. Okay, so here you can see it is 4 years only. So this fits exactly in the clause of dowry death, which is, inquest is done by magistrate. Clear? So there, magistrate inquest. So 2 points you need to remember for magistrate inquest: if there is a death in police custody, or if there is dowry death. Okay, so please remember this dowry death, and magistrate has to take out the inquest here. And the time duration is 7 years of marriage, within 7 years of marriage. Then moving forward, a verbal statement recorded by the magistrate, right? So statement recorded by the magistrate without any oath by an assaulted person narrating the sequence of events responsible for his condition. Now what is this known as? Now here the person, this is the victim here, and victim is giving statement. Now here you need to remember two things. Whether the statement is given to general public or it is given to magistrate. If it is given to general public, this is dying declaration. If it is given to magistrate, this is dying deposition. Clear? So you have to remember this basic fact. Now here the statement has been recorded by magistrate, so the answer will be dying deposition. And in legal terms, dying deposition is more have more weightage than dying declaration. So dying deposition carries more weightage. Clear? So it is more more legal because the magistrate himself is recording the statement, right? So this is dying deposition. Then moving forward, body was found by the side of the road and it was presumed to be a case of road traffic accident. Stiffness was noted in neck and all the four limbs. What is this? If there is a stiffness after injury, that is a usual process, and this stiffness is known as rigor mortis. Clear? So this is rigor mortis, and you can see here the muscles has gone into a state of contraction, because you can see this is the level of the couch and the forearm is in the air. So this is only possible because of rigor mortis. Clear? So this is rigor mortis. Fine? So this is rigor mortis, and should not be confused with cadaveric spasm, in which a group of muscles which were in a state of contraction at the time of death directly passes into rigor without that initial phase of relaxation. Because what happens? Death, there is an initial phase of relaxation, and then the muscles go into rigor. Clear? So this is the usual course. But if the muscles are contracting or if are working at the time of death, as we see if someone is drowning, then what happens? Straight away they go into rigor. So this is known as cadaveric spasm or instantaneous rigor. So this is instantaneous rigor. Right? So the only difference is the initial phase of relaxation, which is seen usually, but in here there is no intermediate initial phase of relaxation. Right? So this is rigor mortis. Now, cherry red color post-mortem staining. I think everyone can answer this. Now, post-mortem staining is also known as post-mortem hypostasis or liver mortis. Now, cherry red should be remembered for carbon monoxide, right? So that's pretty clear, and this is because of pooling of blood in the dependent part of the body, right? So here you can see this is all cherry red post-mortem staining, and needless to say, it will be absent over those areas which were in contact with the surface, like the scapula, sacrum, right? So the pressure points, there will be no post-mortem staining. Otherwise, on the untouched area, there will be post-mortem staining, right? So this is post-mortem staining, and this is absent over bony landmarks which are in contact with surface. Like if the body is on table, it will be in the surface with the table. If it's on the ground, then surface with the ground, in contact with the ground, right? So this is post-mortem staining. Now, an elderly male was found dead on road, and it was said that it's a case of death due to starvation. Now, if you do autopsy, what you will find? Now, what will happen if there is starvation? There will be no digestion process because the person has not eaten anything. Now, if there is no digestion process, there will be no use of bile, yes, and the bile will remain in gallbladder, and therefore the gallbladder will remain full and distended. Clear? So this is the reason why the gallbladder is full and distended, because the bile has not been used, because the person is in starvation state. Now, what is this? During autopsy, the doctor tied the bronchus and checks whether the lungs is floating in water or is sinking. Now, what is this test? Right? So the bronchus is tied, and now the lung is dipped in the water, and the doctor wants to check whether it is floating or whether it sinks down. Yes, this is hydrostatic test. Now, this hydrostatic test actually is done to check whether a newborn is live birth and then killed, or it's a case of stillbirth. Because what happens if the newborn was a live birth? He must have respired. Clear? So the lungs will have air in it, and therefore what will happen if you dip such a lung in the water? Sorry, it will float, right? So if there is a newborn which is dead, and if you do hydrostatic test, and if you find that the lungs are floating in water, it means the child was a live birth and then someone has killed that child. Now, on the other hand, what will happen if it is stillbirth? No respiration took place. Clear? So if it's a stillbirth, it means he never respired. So it means no air in lungs, and therefore the lungs are solid, and therefore if you put them in water, they will sink. So if there is a, yes, very good. So if there is a newborn, a dead newborn, and if the lung sinks in water, you will say with confidence that this was a case of stillbirth. Clear? So this is the concept of the hydrostatic or the Raygat's test. Fine? Pretty important. Then moving forward, a dead fetus was found in the water canal, and the crown heel length was 25 centimeter. So crown is actually head, heel, I think all of you must be knowing. So this is 25 centimeter. There was minimal hair growth but distinct fingernails. Now, how to calculate the age of the fetus? Very good, the answer is absolutely right. And this is based on the rule of Hasse, where age is equal to square root of CHL. Clear? So, this will come out to be 5 months. Clear? So this is pretty clear here. This is rule of Hasse, which actually helps us in estimating the age of the newborn or the fetus if we know the crown heel length in centimeters. Okay, so this is rule of Hasse. Then moving forward, a patient was brought for autopsy. His relatives said that there were tattoo marks in the patient, but no tattoo marks were visible. Now, how we can confirm that whether this, yes, very good, Anas bhai, very good. So what actually happens, suppose if this is skin, then these are lymph nodes. So if there is any tattoo over here, then by the way of the lymphatics, the pigment will reach into the lymph node. Clear? So the pigment will stain the lymph nodes. So even if at a later time, if there is no tattoo here, we can check the lymph node for that pigment. And if the lymph nodes, if the nearby lymph nodes are pigmented, you can say, yes, this person was having tattoo, but now it is not visible. Now, a 14 years old rape victim with 22 weeks of gestation comes to the hospital. Now, what you should not do? In a 14 years girl with 22 weeks of gestation, what is not true? Now here, the very first thing which you need to remember is 14 years. And the thing is that whether the 14 years victim is well grown to give consent, so that is important here, right? So this is absolutely wrong here. Clear? That's why the answer is this, because 14 years consent is invalid. So if the patient requests so, we cannot follow the desires, right? So this is this is specifically in relation to the age. Now, in Barberio's test, we see yellow colored needle shaped crystals. Okay, so we see yellow colored needle shaped crystals. Now what, yes, this is for semen, very good. So in Barberio's test, actually we are using picric acid, and when we use this stain, there is formation of yellow needle shaped crystals of spermine picrate. Clear? And this is the appearance of those yellow needle shaped crystals in Barberio's test if the stain is a seminal stain, right? So this is confirmatory for a stain as seminal stain. So we do Barberio's test and we look for the crystals which are because of spermine picrate. Then moving forward, a farmer consumed some unknown poison, and then he was having dilated pupils, decreased secretions, and dry mouth. Now what is the agent? Very good, Muhammad Anas, very good. Now here look one thing, dilated pupils. Clear? So the pupil will be something like this. So this is what? Mydriasis. Then decreased secretions. Decreased secretions, it is, it can be sweat, it can be saliva, and saliva this is leading to dry mouth. So it means all these features are anticholinergic. So all these are anticholinergic or against parasympathetic, and if you look for multiple D's here, okay, so this all D goes for another D, that is Dhatura. Very good, Mohammad Anas. So this is Dhatura, and you can remember the sign and symptoms like dry as bone. And why the patient is dry? Because there is decrease in secretions. So there is decreased salivation, then there is decreased throat, mouth because of decrease in salivation. So dry as bone. Then blind as bat. Now why blind? Because there is pupillary dilatation and non-reactive to light. Then hot as hair. Why? Because there is decreased sweating, so the skin is hot and dry. Then mad as hatter, again neuropsychiatric symptoms, and red as beet because there is vasodilatation with flushing. So these are few words which you need to remember for Dhatura. Dry as bone, blind as bat, hot as hair, mad as hatter, and red as beet. Clear? So this is all anticholinergic activity. Then moving forward, a patient was brought to the emergency with some unknown poisoning, and then there are needle track ulcers over the upper limb. Then all the vitals were increased, and the patient says that he has history of bugs crawling under the skin. I think the moment you get this word, there has to be no confusion whatsoever, and this itself is very suggestive of cocaine poisoning. So this is what Magnan's symptoms, or please remember formication as well. So these are few terms which defines this tactile hallucination. So bugs crawling under the skin, a classical for cocaine poisoning. Yes, very good, Mohammad Anas. Success, yes, you are absolutely right. Then moving forward, a young male makes random calls to females. So male is making call to female, and he achieves sexual gratification by talking obscenity. And you also share some obscene pictures. What is this kind of perversion? Now this is, yes, success, you are absolutely right. Now this is scatologia. Now here you see the person is making calls, right? Talking useless things, sometimes sharing useless pictures. So that is known as telephone scatologia. Okay? Now stalking means going, following someone. Stalking is different, and this is scatologia. Clear? So the thing is making obscene phone calls, and this is one verbal form of exhibitionism, right? So this is telephone scatologia. Then moving forward, a young female faked pregnancy and then presented with a real child to blackmail her boyfriend. So it means the lady was not pregnant, but he pretended like she is pregnant, and then after some time she came with a child and then started blackmailing her boyfriend that this child is, you are the father of this child. Now what is this known as? This is supposititious child. Very good. So the basic purpose is to blackmail so as to extract some money or some other ill motive. So that is supposititious child. Now here you are getting some more words: superfecundation, superfetation, and spurious child. So superfetation means there is already fetus over another fetus. Clear? So it means there is fertilization in different cycles. Got it? And if there is fertilization in same cycle in two separate acts, that is superfecundation. So fertilization in same cycle, same menstrual cycle, obviously two different acts. So this is superfecundation, superfetation, and spurious is false pregnancy. So here are the terms. Superfecundation, same cycle but two different acts by two different people, and there is fertilization of two ova. And superfetation, two different cycles, and this is what is fetus over fetus. So superfetation. Then supposititious is fictitious, forged or substituted child, and it means it is never born to the woman who is claiming that child to be her, and it is just there is some ill motive behind presenting that child to someone, right? So this is supposititious. Then there is one more term, posthumous child. I think most of you must be knowing this answer. This is child born after death of father. Clear? So this is, yes, absolutely right. This is posthumous. There is one more term, atavistic child or atavism. Now here the child resembles grandparents. Clear? And not the parents. So that is atavism. Clear? So success, Mohammed Anash, both of you are absolutely right. So these are few terms which you should remember, and so that's enough for this session.